Hi there everyone, I'm Lauren Bell. I'm a cognitive behavioural therapist and I specialise in treating common mental health problems such as depression and anxiety disorders. Some of you may know me as the Yorkshire Therapist. So the purpose of this video today is to talk to you in a little bit more detail about a specific therapy technique, a technique called behavioural activation. So behavioural activation is something that we use in cognitive behavioural therapy to help people lift mood and overcome problems with depression. And so this video comes off the back of the Mind Hack showed on BBC Radio Sheffield this morning, which talked about behavioural activation in specific detail. So the idea of the video today is I'm just going to talk you through, in a nutshell, how we use behavioural activation. And this will hopefully give you a bit of an idea of how you might be able to use this for yourself. So the idea and the theory behind behavioural activation is that our mood has a huge impact on what we do. So if we're feeling absolutely rubbish, that will lead us to feel like we want to withdraw and avoid. But then there's also a huge link between what we do and how we feel. So if we start to withdraw and avoid and do things differently, that's going to have an impact on our mood. And if we're withdrawing and we're doing things that we enjoy less, that will probably have a negative impact on how we feel. So the idea behind behavioural activation is we want to try and break down this vicious cycle that we can sometimes get caught in. And the way that we do that is that we specifically target your behaviour. So what I've done here is I've just drawn out a little, just a bit of a diagram. So on here, so as I've spoken about so far, when we feel depressed, low and anxious, that has a negative impact on what we do. So we become withdrawn, we avoid, we have lower activity levels, and we'll actually stop doing some of the usual activities that we would normally tend to enjoy. But the problem is with this, so we feel depressed and that changes what we do, and so that has a negative impact there. And then the problem with this is that these changes in our behaviour then also start to have a negative impact on our mood. So the less our life is fulfilled with things we enjoy, the less we've got a routine and a structure, the more negative and depressed we will feel. And we call this little cycle here a less fulfilling life cycle. So you get stuck in a negative vicious cycle. So in therapy, when we're looking at trying to undo this cycle, behavioural activation is one of our first go-to techniques. And behavioural activation, like I said a minute ago, actually targets our behaviour rather than targeting our mood specifically. We're actually going to work on mood indirectly here. And the reason for that being is that medication is more of a direct kind of way of tackling mood. But as therapists, we don't prescribe and we don't work with medication. So we target the other side of the cycle instead, so our behaviour. And what we tend to find with behavioural activation is if we can kind of look at the behavioural changes, and then if we can very steadily and very gradually teach you how to put in place different kind of goals or activity and structure, the idea and the hope is that that will start to undo this cycle and get you stuck in more of a positive or virtuous cycle. So for example, if we're targeting behaviour here, what we would do is we'd look at the current level of behaviour and then we would try to change that for something different. So like a goal or a routine or a pleasurable activity. You just have to bear with me while I'm writing this. And what we tend to find is if we can get you to engage in these goals and this routine and this pleasurable activity, what this will hopefully do is have a more positive impact on how we feel. So if we do something that gives us positive reinforcement, that will actually make us feel a lot better. Really apologise for the terrible scruffy writing, by the way. So once we start to feel a little bit better and our mood and depression starts to lift, what then tends to happen is that then starts to have a positive impact on our motivation levels and our interest and willingness to engage in these goals. So the more that mood lifts, the better our kind of, or the more inclined we feel to do these things. So we do more of these things and then that has a positive impact on mood. What I always say to my patients, however, though, is that you're stuck in this cycle for a reason. You know, withdrawal and avoidance is a normal kind of response to depression. So if we kind of go hell for leather and we try and set really, really difficult and really, really complex goals straight away, you are going to feel overwhelmed by that and you are going to struggle. So what we want to do instead is we want to be really, really clever, and we want to set some goals, but we want to do it in a way which is manageable and achievable. And so I always draw out this little kind of diagram here. And so I say kind of at the top of here, we'd be looking at what's 100% level of functioning for you. And then when you're feeling really depressed and low, you'll probably be functioning somewhere around here, around the 0% mark. So what we want to do when we're setting behavioural activation goals to begin with, is we want to think small. So we're going to look at like maybe 10% or 20% or something like that. And so you'd initially start by setting goals for this area here, but at the 10 or 20% mark. Once you're able to do these kind of goals, what we can then do is we can then gradually start to kind of increase it and kind of get up to 40% or 50% or 60% level of functioning. And what we'll tend to find is that the more that you can do these, very quickly you'll start to be able to kind of move up the cycle, and then before you know it, we'll get you as close to 100% level of functioning as possible. The other thing to remember, however, and one of the cheesy taglines that I often use kind of when talking about behavioural activation, is something called fake it to make it. And again, I always say to people, you know, it might sound a bit cheesy and a bit kind of, I don't know, yeah, just cheesy really. But the idea behind this is when you're feeling low, when we're engaging in this technique, we want you to fake it and do what you would do if you weren't feeling low. And what the evidence suggests and what we know as therapists is that that will actually make you feel better. So, for example, I often ask my patients, has there ever been a situation where you felt really low, you've really not been bothered to do something, but you've pushed yourself to do it anyway, and then you felt loads better? That's fake it to make it in action. So what we want to do when we're working on behavioural activation is we want to fake it and do what you would do if you were feeling better to make you feel better. And so alongside this, so this is the kind of theory behind it. So alongside this, and I talked about this on the Mind Hack this morning, what we get you to do is to start to fill out a weekly schedule. So the idea is if you're setting yourself some goals and setting yourself things to work on, what we would do is we would use this schedule to plan in when you're going to kind of complete that goal. So depending on how bad your depression is to begin with, you may start with a really, really simple goal of just getting up at a certain time each day. So you'd kind of maybe get up at 9 o'clock or something like that, and plan that in for every day. It's up to you what time you do, and you don't have to do it every single day either. So we get you to plan that in as a goal, and then you might put a little bit of something else in, like a film or a walk or something like that. My writing is horrendous. So we get you to kind of plan in when you want to get up, when you want to do your other goals. And then the idea is that you will use this log to track what happens when you do those things. And so you do that by writing a D for depression, and then once you've completed that goal, what I want you to do is rate your depression level on a scale of 0 to 10. So 10 is the most depressed you've ever been, and 0 is not depressed at all. So you'd kind of go through each goal and put in like how it makes you feel on a scale of 0 to 10. And then if you do other things aside from this goal, you can plan them in as well. So if you've set yourself goals, but you do extra bits, or, you know, you're doing other activity too, write that in, and then again do the same. Track how that impacts on mood. And what you can then do at the end of the week, this is totally optional, but I like doing this with my patients, is you can set like a key at the top of this grid here. Normally I would say like 0 to 3 is kind of mild depression, 4 to 6 is moderate, and 7 plus is severe. And then if you like stationery, or if you've got the access to it, you can then get some highlighters, create a bit of a key, and then highlight your depression kind of scores. And what that will very quickly show you is what activities make you feel better, what activities make you feel worse, what times of day are better and worse. And then once you have an understanding of this, you can then use that to set further goals for yourself to kind of increase the intensity or decrease the intensity of what you're doing. And over time, if you can stick to this very steadily, it will pull you out of that vicious cycle of depression and help you to feel kind of more in control and start getting positive reinforcement from life a little bit more. So I hope that made sense. If you've got any questions about it, by all means let me know. I've uploaded a picture of the activity kind of log to my page. But if you want the actual electronic version, if you just email me, so it's the yorkshiretherapist@gmail.com, I'll happily email you that over. And if you want any additional reading around behavioural activation as well, again, email me and I'll send that through for you to have a look at. But thank you all so much for spending the time to listen to me. Apologies again for terrible handwriting, and I hope you find behavioural activation a useful technique for you. Bye bye.